In this video, we will learn about the drugs tetracyclines. These are a class of antibiotics that are bacteriostatic, and in 1945, there was a microbiologist named as Dr. Benjamin. He was an American microbiologist, and he discovered the first tetracycline, which was chlor tetracycline, during his experiment with a soil bacteria that was Streptomyces aureofaciens. So this was the bacteria from which he first isolated this drug, which is the first drug of this class, chlorotetracycline, and from there the journey or the story of tetracyclines began. So tetracyclines, in this video we will go through the mechanism of action, pharmacokinetics, pharmacodynamics, uses and adverse effects of the tetracycline. So let's start with the chemistry. So as we can see that, as the name indicates, tetracycline has four cyclic structures or ring structures in their molecule. We can see that here we can see that we have ring number 1, 2, 3, and 4. So we have four ring structures or four cyclic structures, and from here the name tetracycline was originated. Tetracyclines itself, they are crystalline amphoteric substances which have a very low solubility, but they are available in the form of hydrochlorides which have good solubility as compared to the parent drugs. So they are available in the form of hydrochlorides. So this was a bit about the chemistry of tetracyclines. Let's dive into the mechanism of action by which they exert their antibacterial effect. So tetracyclines, they enter into the cell by active transport or by passive diffusion through the cell membrane. And once inside the cell, they have binding site at the ribosome 30S subunits. So we can see that ribosomes, it has two subunits. It has a bigger subunit, which is the 50S subunit. And ribosome, it also has a 30S subunit, which is a smaller subunit. So tetracyclines, once they enter the cell, the drug, it goes and it binds to the 30S subunit of the ribosome. So once it binds to the 30S subunit, this subunit is basically responsible, it's act as a decoding center. So this is the center where the transfer RNA molecules, which carries the amino acids, they bind to the messenger RNA codons during the process of translation. So we can see that here the transfer RNA, it is coming. This is the transfer RNA. It is coming with the chain of amino acids. We can see that binding of the tetracyclines, it actually prevents the amino acid transfer RNA transfer of the amino acids. So this actually results in the termination of the protein synthesis. So no proteins will be formed. That means it exerts a bacteriostatic effect. So this is how they act in the bacteria, which means that the first step is usually the binding, and after binding, and they bind to the 30S subunit. After binding, they block the process of translation. It has a very simple mechanism of action. It seems very simple, that it will bind to the transfer RNA and prevent the binding of the amino acids or the cross-linking between these chains, and this step is inhibited. So no further protein synthesis occurs. So this is how it has the antimicrobial effect. So now we will move towards the pharmacokinetics of the drug. So in the list of tetracyclines, we can see that we have these drugs: chlorotetracycline, oxytetracycline, tetracycline, demiclocycline, methacycline, doxycycline, and minocycline. So these are 7 drugs of this group. We also have another drug which is called as titracycline, and it is a slightly different from these drugs, so I'll discuss them later, or I'll discuss them separately. So the chlortetracycline, it has an absorption of 30%. And if you give 100%, 100 milligram of this drug, only 30 mg will reach the systemic circulation, because it has an absorption of oral absorption of 30%. And the drugs doxycycline and minocycline, they have approximately 95% of absorption, which means that if you give them 100 mg, 95 milligram of the drug will reach the systemic circulation. And the rest of the drugs, they have an absorption of around 60 to 70%. So they are 60 to 70% bioavailable. This concept is also known as bioavailability of the drug, which means that the amount of drug that is available in the systemic circulation. This concept is also known as bioavailability. So this is how these drugs are absorbed. So we also have another drug from this group, which is called as tigecycline, and it is only available in the IV formulation, which means that you have to give it in IV, and 100% of the IV drug, it reaches the systemic circulation. So in the heading of absorption, this is how these drugs are absorbed. So they when they are absorbed, or when you give these drugs, they are absorbed in the upper small intestine, which means that in the GIT, they are absorbed in the area of the upper small intestine. There are many things which can interfere with the absorption of these drugs. For example, any divalent cations. Divalent cations, for example, calcium or magnesium, or any ion which has, it could be iron or aluminium as well. So any cation, if you administer the drug with these cations which are present in antacids and multivitamins and the calcium, it is present in the milk and all the dairy products. So if you administer the drug with any of these compounds or medicines, the absorption will be hindered, or there will be a reduced absorption of the drug. Also, alkaline pH, it affects the absorption of the drug. So if you're giving the drug with any agent that reduces or that increases the pH of the stomach, for example, PPIs, so it is going to interfere with the absorption of the tetracyclines. So we need to remember this while administering the tetracyclines in a patient. So next part after the absorption is distribution. So tetracyclines, they are widely distributed in all tissues of the body except for the CSF. In the CSF, the penetration or the concentrations of tetracyclines, they're not very good. So distribution is the second side, is the second component of the pharmacokinetics. So it does not achieve very good levels in the CSF. Apart from that, it reaches the circulation very effectively. So it also, the minocycline, which is one of the drug, it reaches the tears and the saliva as well. So it is also used in the treatment of meningococcal state of the meningococcal carrier state. It is released in the tears and saliva as well. So it has a good concentration in the body fluids as well. It also crosses the placenta, so it can reach the baby if we administer in a pregnant lady. And tetracyclines, they also have the efficiency to chelate divalent cations, as we discussed in the absorption. So they will cross the placenta, they will reach the baby, they will bind to the calcium of the in the teeth and the bone of the baby, and this is how the it is going to affect the growth of teeth and bone in the baby. So they are tetracyclines. They are basically contraindicated in the pregnancy because of this adverse effect. So do not give it in the patients, in the ladies who have a childbearing potential. So this was all about the distribution of the tetracyclines. Now we will discuss about the third factor, which is the excretion. Most of the tetracyclines, they are excreted in the bile, and some of them they are also excreted in the urine. So the two tetracyclines, which include doxycycline and tigecycline, they are excreted in the bile in most concentrations. So any infection which involve the biliary tract, these are the drug of choice. So they are excreted by through the bile. And the rest of the drugs, they are excreted in bile as well as in the urine. So tetracyclines, they have wide variety of clinical uses, and they are choice of drug of choice in the treatment of infections caused by rickets, mycoplasma, plague, in the treatment of chlamydia, spirochetes such as treponema, which cause syphilis. Chlamydia also causes STIs. So mycoplasma, it causes pneumonia. In the treatment of H. pylori, which basically cause gastric ulcers. Vibrio, which causes cholera. It is used for the treatment of plague, tularemia, brucellosis, leptospirosis, Lyme disease, and very interestingly, it is used for the treatment of prophylaxis of the protozoa. It is also used for the treatment of non-tuberculous forms of mycobacterium. So these are all the atypical bacteria. Apart from them, mycobacterium, tetracyclines, they are used for the treatment of acne, exacerbations of the bronchitis, the infections that involves the bronchus, and community acquired pneumonia, which is called as CAP, and it is also used for the treatment of Lyme disease. And formerly, they were used for to treat a variety of common infections, which include gastroenteritis and UTIs. However, many strains of bacteria causing these infections are now resistant. So we have other agents that are used for the treatment of these infections. So now I'll discuss some drugs which have some interesting uses. So we'll start with the minocycline. So as we discussed that minocycline, it is excreted in the tears and saliva. So it was used for the treatment of meningococcal carrier state. But now it has been replaced by some better drug, which is, for example, rifampin. Rifampin is used for the treatment of for the eradication of meningococcal carrier state. Second interesting drug is demiclocycline, and it is a tetracycline antibiotic, but now it is used for the treatment of a syndrome in which an antidiuretic hormone is excreted in an inappropriate form. So it is also known as SIADA, which is a syndrome of inappropriate anti diuretic hormone. And it is used for the treatment of this renal. So this is basically a renal or a kidney issue. And now demeclocycline is used in this indication instead of being an antibiotic. The third drug, tigecycline, it's the most advanced form of for the tetracyclines, and it has a very large or very big profile of bacteria that it covers. It covers all the gram-positive bacteria, which includes MRSA, which is methicillin-resistant Staphylococcus aureus. It also covers Enterococcus, including the vancomycin-resistant Enterococcus as well. So it has a very broad spectrum. It is also used for the treatment of cons, which is coagulase negative staphylococci, and Staph aureus, which we have already discussed here. So all for the treatment of MRSA, MSSA, VRE, which is vancomycin resistant enterococcus, and cons. So all these bacteria, these are gram positive. So it is used for the treatment of gram positive bacteria as well as gram negative bacteria. So it has a very broad spectrum. It covers all the Enterobacteriaceae, which includes E. coli and Klebsiella. It also covers Acinetobacter. It covers all the bacteria that were discussed earlier. Chlamydia, Legionella, Mycoplasma. It covers all those bacteria as well. So now it is a drug of choice in the treatment of all the skin and soft tissue infections and pneumonia and intra-abdominal infections. So it has an FDA approval for the treatment of all these infections. So skin and soft tissue infections, which are SSIs, abdominal infections, and pneumonia. I discussed this drug in detail because now it is widely used in the hospitals for the treatment of multi-drug resistant bacteria. So it's a very important drug. Now we'll move towards the adverse effects of these drugs. So tetracyclines, the most common side effect of tetracyclines are gastrointestinal side effects, and they cause nausea, vomiting, which is the most common adverse effects of almost all the drugs. And it also causes anorexia, which is basically loss of appetite, and it can also cause the overexpression of opportunistic organisms, for example clostridium, which is a gram positive bacteria, and candida. So these are the gastrointestinal side effects of the tetracyclines. A very important side effect of tetracycline is in that they are readily bound to calcium deposited in a newly formed bone or teeth in young children. So when a tetracycline is given during pregnancy, it can be deposited in the fetal teeth, leading to discoloration and enamel dysplasia. It can also be deposited in the bone and the form deformities. Next, they have hepatotoxicity. They affect the hepatic function, and they can cause hepatic necrosis. In the kidneys, they can form renal tubular acidosis, and all the other injuries that may result in the nitrogen retention in the body. So intravenous drugs of the tetracyclines administration, it can result into venous thrombosis. So systemically administered tetracycline, especially demeclocycline, it can induce sensitivity to UV light. So especially demeclocycline is notorious for this indication. So this was all about the tetracyclines. Thank you very much for watching the video.